My name is Ron Hanna. I'm a Community and Staff Development Instructor for Organizational Development at Penn Highlands Du Bois. Organizational development provides orientation as well as education for the healthcare staff, including nursing here at Du Bois. Organizational development does provide many classes for the hospital and nursing in particular. We do offer American Heart Association classes, including advanced cardiac life support, pediatric advanced life support, healthcare providers, CPR. There's a PAIRS class that we offer as a precursor, which is more of an assessment class before someone would take PALS. We offer those initially, and then we offer them a variety through the year. Basically, almost every month we have classes that are going on to meet the needs of not only the initial provider, but also whenever you're renewing for any of those disciplines. We also offer basic arrhythmia class, which is required per the job description for many nurses at the hospital. We offer that routinely throughout the year. Additionally, we have classes like comprehensive crisis management for those working in ER or behavioral health. And our department also manages our e-learning program at the hospital, which is currently net learning. And the e-learning is where we do a lot of our mandatory education, like for example, the mandatory fire prevention or fire safety, lifting safety, exposure safety, etc. And those are done on an annual basis. We try to give at least 9 months for folks to be able to do all of those. They're due at the end of June every year. And the nice part of the e-learning is you can do it at 2 in the morning if you have 15 minutes, or you can do it at 2 in the afternoon. We don't have to have people scheduled to come into an actual live class. In addition to those mandatories, there are some elective things that you can do on e-learning as well. And most of the classes that we offer here at the hospital, ranging from the Heart Association classes to just some continuing education topics, have continuing education credits associated with them that we can provide. And those credits can be used towards the RN license renewal that's used every 2 years. So it's nice to be able to have that here and locally and be able to get at least a majority of them, as opposed to having to go elsewhere to get your continuing education. One of the things that's unique here at our facility is actually the building. We do have the Central Resource Center, which used to be a high school, and that's where organizational development's located. We do have multiple classrooms that are actual classrooms with blackboards in them, which are kind of nice to be able to use for classes and breakout sessions. There's plenty of room with that. What makes our department also unique is that all of the staff have a minimum of a master's degree. We all also have a minimum of 10 years experience in education, and also a minimum of 20 years in healthcare from a diverse background. So it does bring a lot of background and a lot of experience into the department.